Tracking the vaccine for you tonight. South Carolina will soon need a lot more of the vaccine. We talked to the governor about that shortage today as lawmakers passed an unprecedented $208 million plan to speed up the rollout. Now, the bill received unanimous support and will give hospitals tools to administer those shots faster and change who can give them out.
Fox Carolina's Matt Kaufax live in Greenville. Matt, we understand the bill does a lot more than that, doesn't it?
Yeah, Cody, that's exactly right. Lawmakers I spoke to today tell me this bill is also going to tackle the issue of getting vaccine to more remote rural areas that might not have better access to health care. At the end of the day, though, every building across the state like this one, they're aiming to get more vaccine into these doors and into arms of the people who cross them. They also say they are going to be tackling misinformation as well. Governor Henry McMaster was blunt today when asked about vaccine supply issues.
Fairly soon we'll be needing a lot more vaccine than we get, and we're just hoping that the manufacturers will be producing it at that time.
Thankfully, help could be on the way at the state level with the passage of Bill 3707.
It's about planning for the day that we do have ample vaccine.
Greenville County Representative Chandra Dillard says one of the most important aspects of this bill is that it authorizes more people to administer the vaccine.
We're talking about the nurses, nurse practitioners, students.
She says the bill would make it so that you don't have to be a specific type of doctor. If you know how to give a shot, you can.
These are the people that we want volunteering. And of course, they have to be COVID certified.
That's why the bill also pays for training to get previously unqualified medical professionals up to snuff.
We know that we have rural communities that have an access problem.
Dillard says the bill also allows the state to repair existing mobile units and purchase new units outfitted with cold storage to bring the vaccine to rural areas and urban pockets where healthcare is scarce.
We're going to buy some of these mobile vans and we're going to get them out there.
Finally, she says it addresses one of the most vital aspects of all.
We have pockets of people who are still not sure if they should take the vaccine.
Dillard says this bill will help better equip agencies to run targeted campaigns focused on getting the facts out there in each unique community.
It creates the framework by which we can create an atmosphere of education and trust.
Obviously, we will see how all of these different aspects roll out of this bill in the coming weeks and months, I'm sure. One thing Dillard says this bill does not do, though, and for good reason, she says, is it does not give any prioritization to certain groups to get the vaccine in front of the other. She says that was intentionally left out of this bill because that is a duty that falls to DHEC and, by extension, the office of Governor Henry McMaster. She says, in the meantime, she wants folks to continue to be patient. They are working, and eventually everyone who wants a vaccine will get one. They just need more time. In Greenville, Matt Kaufax, Fox Carolina, the 10 o'clock news.